Gum disease primarily, of course, has an effect on dentition, so untreated gum disease will eventually lead to tooth loss. But it starts usually with bleeding gums, with a certain discomfort in the mouth, with teeth becoming mobile and loose. Of course, has then also a very severe effect on general health, which we know nowadays that there is a correlation between gum disease and certain heart conditions. There is a correlation between gum disease and diabetes, and they go hand in hand together. You have to imagine when somebody has gum disease, they have a lot of bacteria attached to the root surfaces, and those bacteria that sit there, they also migrate into the gums. And what happens is, because it's an inflammatory process, the blood vessels in the area, they're not as tight as they used to be. So bacteria manage to penetrate the blood vessels and therefore circulate in the whole body. And that bacterial circulation in the whole body has, of course, effects on the general health as well. So somebody with gum disease, for example, is more likely to become a diabetic down the line than somebody who looks after their gums. We have two main types of gum disease. So one is what we call a gingivitis, and that's just a local inflammation of the gums which did not lead to any destruction of the tissues around the tooth. Very easy treatable with just a professional cleaning. The more serious type is unfortunately irreversible. So the more serious type means that the bacteria penetrate the root surface deeper down and they affect the tissues that holding the tooth in place. So we have the gum and we have the bone and we have certain other anatomic structures which embed the tooth in its position. And once the bacteria manage to migrate down that root surface, that usually leads to destruction of these tissues that hold the tooth in place. It is directly linked to oral hygiene, but also has many other factors which include genetics or certain habits of people. In very many people, it stays quite unnoticed for a very long time, so regular checkups are an absolute must in this case to detect the disease in an early stage and then to be able to treat it, which in general offers us very high success rates.